of the Town.
नमस्कार, म जगदीश खरेल। कार्यक्रम टक अफ द टाउनमा यहाँहरूलाई हार्दिक स्वागत छ। हामी निरन्तर खानेपानी र सरसफाई सम्बन्धी बहस यहाँहरू सामु जोडिरहेका छौँ। आजको कार्यक्रममा भने हामी सेफली म्यानेज सेनिटेसन अर्थात् सुरक्षित तथा दिगो सरसफाईको विषयमा चर्चा गर्नेछौँ। नेपालको राजधानी काठमाडौँमा सरसफाई सम्बन्धी विश्व सम्मेलन भएको छ। यो ग्लोबल समिटमा 20 भन्दा बढी देशका 150 भन्दा बढी प्रतिनिधिहरू सहभागी भएका छन्। सरकारी, गैर सरकारी, निजी क्षेत्र लगायत विभिन्न क्षेत्रका सरकारवाला तथा व्यक्तिहरूको उपस्थिति रहेको यो सम्मेलनले महत्त्वपूर्ण निष्कर्षहरू निकालेका छन्। खास गरेर सरसफाईमा अहिलेको अवस्था, चुनौती, उपलब्धि र आगामी दिनमा गर्नुपर्ने कामहरूको सन्दर्भमा महत्त्वपूर्ण निष्कर्षहरू आएका छन्। आजको कार्यक्रम टक अफ द टाउन यही ग्लोबल समिटमा केन्द्रित रहनेछ। वाटर एडसँगको साझेदारी तथा विभिन्न संस्थाहरूको सहयोगमा युनिसेफ र WHO ले सेफली म्यानेज सेनिटेसन सम्बन्धी विश्व सम्मेलन आयोजना गरेका हुन्। काठमाडौँमा आयोजित यो सम्मेलनमा 20 भन्दा बढी देशका 150 भन्दा बढी प्रतिनिधिहरूको सहभागिता रहेको थियो। सबैको सहज पहुँचमा सुरक्षित तथा दिगो सरसफाईको सेवा तथा सुविधाको मूल विषयमा नै केन्द्रित रहेर विभिन्न प्रस्तुति तथा छलफलहरू भए। कार्यक्रमको उद्घाटन सत्रमा वाटर एड नेपालका कन्ट्री डिरेक्टर सुदर्शन नेउपानेले विश्व सम्मेलनको उद्देश्यमाथि प्रकाश पार्नु भएको थियो।
Today, we must ask ourselves how will we, as key players in the wash sector, rise to this challenge? Our strategies born from collective knowledge and diverse experience will pave the way for our respective countries to rapidly progress towards our shared vision of sanitation for all. This room is truly a melting pot of expertise, knowledge, innovation, inquisitive minds on wash and especially on safely managed sanitation. And this is where we hope to come up with some answers and more concrete actions to accelerate progress by promoting greater alignment and shared understanding on what is needed to better support countries in making that crucial shift towards reaching universal access to safely managed sanitation.
कार्यक्रममा WHO नेपालका प्रमुख डाक्टर राजेश पाण्डवले सेफली म्यानेज सेनिटेसनको सन्दर्भमा WHO ले नेपाल सरकारसँग मिलेर काम गरिरहेको र आगामी दिनमा गर्नुपर्ने साझेदारीको विषयमा समेत उजागर गर्नुभयो।
Recent data indicates a resurgence with nearly 10% of the population resorting to open defecation once again. In 2022, 61% of the population have safely managed sanitation services, just short of close Nepal's SDG target of 62%. As for the data shows, challenges persist, particularly for safely management of fecal sludge in many rural and semi-urban areas. In Nepal, as in other developing countries, urbanization pressure, infrastructure gap, financial constraints, and public awareness are still the major challenges. Informal settlements with inadequate sewerage, limited toilet space, and poor waste management deepen inequalities, especially where sewage contaminates low-lying areas. Climate change worsens these issues with floods, landslides, and water scarcity disrupting services. Strengthening institutional capacities, promoting behavioral change, and ensuring the participation of communities is essential to meet SDG Goal 6. We must acknowledge and address budget shortfalls to reach this goal.
युनिसेफ नेपालका प्रमुख एलिस अकुङ्गाले सरसफाई मानवाधिकारको विषय भएको उल्लेख गर्दै परिणाममुखी कामको लागि सबै क्षेत्र गम्भीर बन्नुपर्ने बताउनुभयो।
We who are in the front line should ensure that every individual has access to sanitation, which is not just about infrastructure, but is also about privacy, it's about dignity, it's about safety, it's about accessibility and affordability. and this forms the core of development for humanity. Poor sanitation disproportionately affects the most vulnerable populations. This exacerbates inequities and perpetuates the cycle of poverty. The adverse effects are felt most acutely by children and women, the elderly, and the people with disabilities. It's our collective responsibility to ensure sanitation, therefore, and address the disparities and create a more equitable world for everyone.
सरसफाई सम्बन्धी ग्लोबल समिटमा बोल्दै स्वास्थ्य मन्त्रालयका अतिरिक्त सचिव डाक्टर दीपेन्द्र रमण सिंहले स्वास्थ्य, सरसफाई र स्वच्छतालाई सँगसँगै जोडेर साझा एजेन्डाका साथ काम गर्नुपर्ने बताउनुभयो।
नेपाल Ministry of Health and Population through National Health, Education, Information, Communication Center is developing, producing and disseminating sanitation and hygiene-related health messages and materials to promote and support health programs and services in an integrated manner. But we need to strengthen educational campaigns to raise awareness about health and sanitation education into school curricula, to instill good practices from very young ages, and engage communities in planning and implementing sanitation projects to ensure they meet local needs and are sustainable.
कार्यक्रममा खानेपानी मन्त्रालयका सचिव सुरेश आचार्यले सुरक्षित तथा दिगो सरसफाईको लागि सरकार तथा सरोकारवाला बीच साझेदारी अझै बढाउनु पर्नेमा जोड दिनुभयो।
I am confident that the discussion and deliberation that will take place during this summit will lead to effective outcomes. I look forward to the productive deliberation and thank you for your dedication, commitment and participation. The insights gained from this summit will guide us in formulating future sanitation policies and plan for the countries like ours.
सरसफाई सम्बन्धी विश्व सम्मेलनमा नेपाल सरकारका खानेपानी मन्त्री राजेन्द्र कुमार राईले नेपालमा दिगो तथा सुरक्षित सरसफाईका लागि सहयोग तथा सहकार्य गर्न विकासका साझेदार तथा सरोकारवालाहरूलाई आग्रह गर्नुभयो। साथै उहाँले नेपाल सरकारको तर्फबाट प्रतिबद्धता समेत व्यक्त गर्नुभयो।
यो शिखर सम्मेलनको उद्देश्य सरसफाईको एजेन्डा अगाडि बढाउनु हो। सरसफाईको क्षेत्रमा सरोकारवालाको बीचमा समन्वय सहयोग, एक आपसमा अनुभव बाँड्ने, दीर्घकालीन व्यावहारिक रूपमा समाधान खोजी गर्नुपर्ने जरुरी छ। सबैको लागि सुरक्षित दिगो र सरसफाई प्रणाली सिर्जना गर्न हाम्रो लक्ष्य हो र म उपस्थित सबैलाई यो शिखर सम्मेलनमा सक्रियपूर्वक सहभागी भई आफ्नो दृष्टिकोण, आफ्नो विचार, आफ्नो अनुभव र साझा विचारहरुमा केन्द्रित भई छलफल गर्नुहुन्छ भन्ने मैले सोचेको छु।
ग्लोबल समिटमा सेफली म्यानेज सेनिटेसनसँग जोडिएका विभिन्न विषयमा प्रस्तुति तथा छलफलहरू भए, जसमा नेपालको पनि सक्रिय सहभागिता रह्यो। सुरक्षित तथा दिगो सरसफाईको लागि यो क्षेत्रमा लगानी बढाउन जरुरी छ। यसैलाई मध्यनजर गर्दै फाइनान्सिङ फर सेफली म्यानेज सेनिटेसन सम्बन्धी महत्त्वपूर्ण सेसन भएको थियो, जहाँ नेपाल लगायत विभिन्न मुलुकले प्रस्तुति तथा छलफल मार्फत सेफली म्यानेज सेनिटेसनको लागि फाइनान्सिङका विभिन्न विषयमा चर्चा गरेका थिए।
From my perspective, it's really looking at what the comparative advantages are of public and concessional finance vis-à-vis private finance. So from my perspective, on the public and concessional finance side, investment should be really around upstream project development, having a project pipeline, correcting market failures, whether that be where there aren't sufficient investments or where poor areas are not being targeted, stimulating commercial investments, making an enabling environment for the private sector to come into, and then potentially using instruments such as loan guarantees to reduce risk and encourage private investment.
So we have a really exciting marketplace or trading floor session for you this morning. So we're looking for solutions or pieces of solutions for the financing issue that we're facing for sanitation. We do have an exciting session. We have 12 topics for you. You see those topics on the slide, but also you should have a copy on your table.
सम्मेलनको अर्को सेसनमा डेटा सिस्टम स्ट्रेन्थनिङको विषयमा चर्चा गरिएको थियो। प्रेजेन्टेसन तथा प्यानल डिस्कसन मार्फत गरिएको गहन छलफलमा नेपाल लगायत अन्य देशका सरकार तथा सरोकारवालाहरूले भाग लिएका थिए।
We're not just talking about global monitoring of data, we're really talking about data and data systems across the whole chain, from local data needs, national and then global, and how these also all interrelate with each other. So at the local level, we need data to manage services, assess risk, and identify demand, use markets as well, and also to inform local planning and resource allocation.
Basically, this I wanted to show you the evolution how our data system was made. It started from the functionality and sustainability monitoring and evaluation system for rural water supply. So overall, NWASH MIS started from that one. Then we came into the WASH plan, where we wanted to do SDG 6.1 and 6.2 reporting and help the local governments to formulate their plans based on this SDG 6.1 and 6.2. We noticed that the water quality data was still not there, so we integrated the water quality data, and now we are trying to reach the utility career paths and business plan of utilities and tariff calculation also through the data system, and also trying to reach the trying to do the market analysis, whether we have the private sector's presence or not, how we can create the private sector's enabling environment through our data systems. Meanwhile, we are doing the governance assessment of the local government through these data systems. So if you look at the data layers, you can see all of the data that feed into our system comes from the local governments. The provincial government also uses those data where they validate and use it. So federal government prepares the guideline, they update the guideline, and they use these data systems. So we try to see three kinds of data inside the system. We try to see whether the local government have the information on SDG 6.1 and 6.2, and how we can generate the information on 6.1 and 6.2 for local governments. And based on that one, local government will be able to decide how much investment will be required. So that we have automated inside the system, how much investment will be required. And we also want to assess the institutional capacity, how much institutional capacity will be needed in water supply and sanitation landscape. And we try to collect that, and we try to link it with the capacity building area, that whether if the capacity is not enough, we try to link it with the capacity building area, these data. So we have named it municipal WASH plans. All the data are fed into the systems where we use it to formulate the municipal WASH plans. And among those, the sanitation data are one of those pillars.
We are talking about strengthening data from local level. In sanitation service provision, the data should actually come from the users, the customers. The customers to private operators, utilities, regulators, and as we go up, at lower level, the data are disaggregated, but as we go up, for national or regional global reporting, we will have aggregated data.
The funding way that we can integrate together. Actually, for me, from Ministry of Rural Development, we have been working with National Institute Statistics several times, and we discussing whether we can integrate or we can work together in designing a questionnaire together and work together in harmonizing the definition, like I mentioned in in technical terms like septic tank and pit in my presentation. So we have been developing the draft of the leaflet about the type of latrine, and so we all can understand together, use the same term, and also can combine a questionnaire into one.
After our 4 panelists have had their photo taken, I'm going to invite up our 3 panelists who are coming from Indonesia, from India and Uganda, and Frank Odiambo from the UNICEF Regional Office is going to moderate the discussion with the panelists.
The reporting system collecting data in Indonesia, IMONEF GLTS, from sanitarian in primary healthcare, and primary healthcare under the village, and then primary healthcare under report in district level, and district level report delivery in province level, and province level next the national level and the collect Ministry of Health.
And I just want to mention 2 small points and I'm done. One is there is an annual survey that's happening in the country. This is a follow-up of the World Bank project. The World Bank project has ended now, but they have initiated an annual survey, and around 15,000 villages are visited in the annual survey randomly. There are approximately 500,000 villages in India. 15,000 villages are visited, and the data on the MIS is cross-checked to make sure, and the data on the MIS is also available for anyone to access in the public domain. So that is another way of validation. And the other thing is the government is now interacting closely with the JMP team. Rick, Tom were there last year, and they're trying to incorporate the JMP indicators into the annual surveys. So in that way, hopefully moving forward, they'll be able to align themselves with the need for reporting and safely managed.
In the past few months, we've made efforts to have these incorporated into this system. The same applies to Ministry of Water and Environment. They also have a system that largely has been looking at water. The same applies to education, that has been looking at educational issues. So there is an effort to have a system that is integrated.
When you have a data system that is inherent to your service delivery system, as we hear emerging in some of these cases, then you can make choices about your financing that allow you to save money and allow you to advocate for investments that allow you to expand your services faster and support more sustainable and equitable outcomes. So I think overall, in a nutshell, I guess like really shifting from data systems that tell you about services to really data from service systems and from governance systems is the absolute direction that we're needing to go. And I think in the next year, we're going to have a lot more examples.
ग्लोबल समिटमा सरसफाइलाई सर्भिस डेलिभरीसँग जोड्दै अर्बन तथा रुरलको फरक पर्सपेक्टिभबाट समेत छलफल गरिएको थियो। प्रेजेन्टेसन तथा प्यानल डिस्कसन मार्फत विभिन्न क्षेत्रका सरकार तथा सरोकारवालाहरूले गहन छलफल गरेका थिए।
So as you probably know, sanitation service delivery at scale is one of the key steps in the 8 steps towards safely managed sanitation services. And why is this really needed? Well, we know that the world is off track to achieve universal access to safe sanitation by 2030, despite all the progress that's been made to date since the year 2000. So we still have 3.5 million people who continue to not access safely managed sanitation, and 419 million people who continue to practice open defecation. And if we really want to achieve this SDG target of universal access to sanitation by 2030, that's in just 6 years' time, we will need to accelerate the rate of progress by about 5 times the current rate of progress.
So what's different about urban settings? Yes, we both want to go, both rural and urban wants to go area-wide, but urban is a challenge. A big challenge in the sense that we have a diversity of people coming from different regions to an urban area. They have different ethnic backgrounds. They may also have different property owning characteristics, some being tenants, some being informal, some being landowners.
Just reflecting on your tenure as mayor, what would you say are the key enablers that have been most impactful in driving sanitation services at scale in your city? And feel free to draw on approaches, strategies that you've implemented during your time as mayor to expand, improve sanitation services.
We have developed a citywide inclusive sanitation action plan to ensure municipality is accountable, responsible, and capable to do adequate resource planning to ensure safe, equitable, and sustainable sanitation for the cities of the municipality.
The role of regulation in sanitation service provider is to formalize the sector by providing regulatory guidance to those working in the sector.
To support and expand the sanitation workforce effectively, several critical steps must be taken. First and foremost, there is a pressing need of comprehensive training and education program to provide individuals with the necessary skill and knowledge. Secondly, ensure favorable working condition, maximum support, and access to proper tools are essential to maintain workforce satisfaction and efficiency.
We currently improve the sanitation on all sectoral, including the private-public partnership, and also from the social and religious availability. And then the last is about the increase of the community's development, and also increase how to make a change behavior in the national level on how to use the safely managed sanitation. Thank you.
When you talk about the service provider, how can we really differentiate between the different economic status? So poor, rich, middle class, so that the tariff can be planned accordingly. And at the end, again, I want to say that I'm quite optimistic with this group discussion, and we can really reach too many things if we can continue this kind of dialogue. During first day, yesterday also we discussed a little bit about the foundation, winding down doesn't mean that we are stopping. So our strategy is also like, how can we work together with you? How can we facilitate this peer-to-peer learning? How development partners will be facilitator, and then the country partners will come forward. So those are things we will be continuously doing together with you. We have still a long way to go, and thank you so much for all colleagues. Thanks.
First of all, just under half of the rural population has access to safely managed sanitation. 2 out of 3 people lacking at least basic sanitation are in rural areas. And 9 out of 10 people practicing open defecation are in rural areas as well. So this represents a huge achievement. So massive. Over the last decade, there's been sustained effort on eliminating open defecation.
This renewed focus on universal access in the rural area in line with the SDG 6.2, and the recognition that past intervention approaches, as Andy articulated, and also the partnership modalities have been fragmented and often unsuccessful in sustaining the gain once made.
For Kenya, we have involved the community, actually the beneficiaries of sanitation. These are the community health promoters. And as a country, just as recent as last year, the president enacted the primary health care bill. Actually an act, signed it into an act.
My takeaway, to say, one point is it's more about we need to work on the system, which is real foundation of the water, sanitation, and hygiene work, even for other work. So let's join hand together to work on the foundation, because we talk about because of fragmented intervention, we are not achieving this, right? So if we have to scale at this, like all the service delivery at a scale, we have to work on the foundation. That is my takeaway. Thank you so much.
And can I ask the topic leads to walk towards your stations right now, and
ग्लोबल समिटमा सैनिटेशन गभर्नेन्स पोलिसी एन्ड रेगुलेशन्स, क्लाइमेट रेजिलेन्ट सैनिटेशन, क्यापेसिटी स्ट्रेन्थनिङ लगायतका विषयमा पनि महत्त्वपूर्ण छलफल भयो। 3 दिनसम्म काठमाडौँमा भएको विश्व सम्मेलनमा सरसफाइको विभिन्न एजेन्डाहरूमा औपचारिक तथा अनौपचारिक छलफल भयो। यो सम्मेलनले सबैको सहज पहुँचमा सुरक्षित तथा दिगो सरसफाइको लागि महत्त्वपूर्ण निष्कर्ष निकालेको छ।
I think we achieved really to have the common goal, and they really reconfirmed that from global to national to subnational level, municipality level, with community members, engagements, and also other service providers and operators. But in order to achieve this safely managed sanitation for healthier society, healthier environment, there's so much components, steps in the sanitation systems that we have to continue to address and also accelerate that effort. And when we work other partners in these systems, wherever the areas or components that we work in, we need to keep reminding ourselves that this gender inclusion aspect, in order to achieve area-wide, country-wide outcomes towards safely managed sanitation. This outcome for everyone, everywhere.
सुरक्षित तथा दिगो सरसफाई अर्थात् सेफली म्यानेज सैनिटेशनको सन्दर्भमा जुन ग्लोबल समिट यो विश्व सम्मेलन भएको छ र यसको होस्ट गर्ने आयोजना गर्ने जिम्मेवारी सफलतापूर्वक जुन नेपालले निर्वाह गरेको छ, यो असाध्यै नेपाल र नेपालीका लागि गर्व गर्न लायक कुरा हो। नेपालले सफलताका साथ यो समिट सम्पन्न गर्यो। यो ग्लोबल समिटले हामीलाई दिगो विकास लक्ष्य हासिल गर्न पनि र खास गरेर सेफली म्यानेज सैनिटेशनको उपलब्धि हासिल गर्नको लागि पनि निकै मद्दत गर्छ भन्ने अपेक्षा गरिएको छ। तर यसको लागि सम्बन्धित निकाय जागरुक बन्न जरुरी छ र त्यही अनुसारको तदारुकता देखाउन जरुरी छ। यसका साथै अहिलेको लागि यो कार्यक्रम यही बिट मार्ने अनुमति चाहन्छु। कार्यक्रम युनिटका सम्पूर्ण सहकर्मीहरूको साथमा मलाई पनि बिदा दिनुहोस्। नमस्कार।
Talk of the Town.